Hello everyone. So let me just check. Am I audible? Is the screen clear so that we can start the session? Yeah. Okay, so yes, I'm audible. The screen is clear so that we can start the session. So please let me know. You can reply in the messages. You can ask your doubts in the live chat. Okay, so this is a very, very important session for the MDS November 2025. So we are going to discuss the most important MCQs of INI-CET examination previous year, and also the MCQs are based on the topics which is generally asked in examination. So that is an important point. So we will discuss that. So one by one, let me start with the first MCQ. So firstly, let me know, students, am I audible? Screen clear? Okay. Yes. So I was just checking. Yes, the screen is clear and I'm audible. Okay. So yes, you can ask any of the doubts in the live chat. So we will start with the first MCQ. Identify the oculomotor nerve in the given diagram. So basically, image-based questions are basically many times asked in the INI-CET exam. So it's very important that you should be well aware with all the image-based MCQs. That is very, very important for you. So in this MCQ, you have to identify oculomotor nerve. So basically, I would like to enlarge this, and to an extent, it's very easy to identify this A. Why? Because it is the ICA. So what is A? This is internal carotid artery. Okay, so this is internal carotid artery. Then we have got this thick nerve which you are seeing is the fifth cranial nerve. So this is the fifth cranial nerve, the trigeminal nerve. So, and we have got B. In this diagram, we have got B as the oculomotor nerve. And we have got C as the trochlear nerve. So basically, we know that oculomotor nerve is lying close to the internal carotid artery in this image, and this is related in the lateral wall of the cavernous sinus. Here, the location is corresponding location of oculomotor nerve is the B. Okay, B marked structures. The oculomotor nerve we know is a very important nerve which is giving innervation to all the extraocular muscles, and it is also carrying parasympathetic innervation for pupillary constriction because it supplies sphincter pupillae muscle, and it also supplies ciliary muscles. So it is very important for the accommodation reflex. Sorry. So in this diagram, we can identify B as the oculomotor nerve. This B is the oculomotor nerve, and close to it we have got this is the oculomotor nerve, and close to it we have got A as the internal carotid artery. The thick nerve which is related with the petrous part of the bone, this is the trigeminal nerve. Okay, this is the second, this is the third cranial nerve, the oculomotor nerve, and this will be the trochlear nerve which is lying close to the oculomotor nerve. Is it okay? So with this we are coming to the correct answer, and we are knowing why the other options are incorrect. Let me discuss. So it's very important that for oculomotor nerve you should be knowing which all muscles it innervates. So it's innervate all the extraocular muscle except lateral rectus and superior oblique muscle. You should be also knowing the clinical anatomy, and it can be compressed in the condition of cavernous sinus thrombosis, aneurysm of the surrounding structures and the arteries, and in the case of uncal herniation. And if the lesion of oculomotor nerve results in ptosis, that is drooping of upper eyelid due to the paralysis of levator palpebral superioris muscle. Other than that, it also causes dilated pupil due to the due to the involvement of non-movement or non-working of the sphincter pupillary muscle. So that all things should be known to you. Now coming to the next one, that is question number 2. So those who want to reply for the answers, they can reply. Is it okay? Good evening. Yes, good evening everyone. Good evening. Good evening. Any doubt, please let me know. Okay, now let's move on to the next MCQ, which is again a image based question, and you have to identify what is A joint and what is B joint. So you have to know what is A joint and what is B joint, which is very important for you to give the right answer. Okay, A and B. Okay, So it's actually A is actually, you can see this is an articulation. This is I for incus and this is M for malus and this is the stapes. So that means malus and incus articulation is saddle type of articulation. So A is saddle and B is ball and socket joint. So yes, it's so I think a few students has given the right answer. So the image based question about this is a question of general anatomy, and we have discussed that the articulation between malus and incus, we know that there are 3 year cycles: malus, incus and stapes. The articulation between malus and incus is an example of saddle type of synovial joint, and the articulation between incus and stapes is an example of ball and socket type of synovial joint. Okay, so we have got the right answer here. Okay, any doubt, my dear students? If you have got any doubt, please let me know. Okay, if you are having any doubt, you can let me know. Okay, dear. Now coming to the next MCQ. So obviously, we have done with the right answer. Now coming to the next, other joints are incorrect. Condylar, plane, and hinge. These are not the example. Condylar joints examples are mainly that of condylar articulation in the TM joint. We have got plane joint in acromioclavicular joint. We have got plane joint in costotransverse costovertebral joint. We have got hinge variety of joint in the interphalangeal joint and in elbow joint. Let's talk about the next question. So all are the features of cavernous sinus thrombosis except. Actually, I will solve important MCQs related to the topic also along with you, because this is very important. Exactly the same questions are not repeated. The topic is repeated. If we see the topic of the INI-CET exam, that is repeated. So it is also important for you to know the corresponding topics. So cavernous sinus thrombosis features are all. So all are the features of cavernous sinus thrombosis except the option A is papilledema, B is exophthalmos, diplopia, and option D is sensory loss in the entire face due to involvement of 3 branches of trigeminal nerve. Okay, so we have to come to the correct answer. So one of an important point about cavernous sinus is we know that cavernous sinus is dural venous sinus. It's a dural venous sinus, one on either side in the middle cranial fossa, one on either side of the body of sphenoid in the middle cranial fossa. So basically, cavernous sinus is formed due to the separation of 2 layers of the dura mater, the endosteal and the meningeal layer. And basically, in this, if I talk about cavernous sinus, there is exophthalmos, there is presence of diplopia and papilledema, but the answer is D, right? Why? Because we know that if we are talking about the sensation of entire face, it will be due to 3 branches of trigeminal nerve. Is it okay, dear students? Yes, D is absolutely correct, dear. So it is 3 branches of the trigeminal nerve: the ophthalmic, the maxillary, and mandibular. So ophthalmic is giving sensory innervation to upper part of the face. The middle section of the face is getting innervation from the maxillary division of trigeminal nerve, and the lower part of the face is getting innervation from mandibular division of trigeminal nerve. So we can't tell that the entire sensory loss in the face is due to the involvement of 3 branches of trigeminal nerve, but all these 3 nerves are not related in cavernous sinus. If I talk about the cavernous sinus relation, so that is important. So see this diagram. So if you will see this diagram, you can clearly see, I'm just highlighting the nerves. Okay, so what we can see inside, the abducen nerve is related, and in the lateral wall we have got oculomotor, trochlear, and ophthalmic division of trigeminal nerve related. Actually, maxillary division of trigeminal nerve is not now included as a relation in the lateral wall of cavernous sinus. That means ophthalmic division of trigeminal nerve, oculomotor, and trochlear nerve along with the abducen nerve is related in cavernous sinus. So we will not have all the three division of trigeminal nerve being related in the cavernous sinus. So the entire face sensation is not gone. Okay. So that is absolutely, we have got the correct answer. Now we will move on to the. So basically, if I talk about other options, like why the other options were present. So papilloedema is present due to increased intracranial pressure and impaired venous drainage. If I talk about exophthalmos, it is due to the venous congestion and inflammation of the orbit. If I'm talking about the features of diplopia, we know that the extraocular muscles is specifically supplied by the nerves related in the cavernous sinus, that is third, fourth, and sixth nerve. So this is also correct. So we have got the right answer. Yes, good evening everyone. Good evening everyone. Let's move on to the next MCQ. So everyone is this okay? We have come up with this. Now let's move on to the next MCQ, that is question number 4. So again, as I told you, clinical questions and image based questions are favorite questions for the INI-CET exam. So in this image, what is the main action of the muscle marked here? So you can see red color arrow is marked on the muscle, and you have to know the correct action of the muscle mark. So we will have to know that. So firstly, you have to just enlarge this and tell me the right answer. So this is the muscle. So, okay, this is the muscle, and which muscle is this? Exactly, you have to identify this. Which muscle is this, my dear students? This is the masseter muscle. Which muscle is this? This is the masseter muscle. Okay, so you have to tell me what is the action. So the muscle marked is the masseter muscle. What is the action? Whether it is elevation, whether it is depression, retraction, and protrusion. Masseter elevation is absolutely right answer. Absolutely right answer. So the image is showing the masseter muscle, one of the primary muscle of mastication. And masseter muscle is responsible for elevation of mandible, which is very important for biting and chewing action. The other muscle which works along with this masseter muscle for the action of chewing the food particles, that is the masticatory muscles. They are temporalis, medial pterygoid, and lateral pterygoid, which is performing the jaw movement. So clearly, if I have to go with the most correct answer, I will go with elevation of mandible. Okay, done, my dear students. Let's move on to the next. So obviously, elevation of mandible is correct. Depression is not correct because it's the primary action of lateral pterygoid muscle. Retraction is the primary action for the posterior fibers of the temporalis muscle. Protrusion is the primary action of lateral pterygoid and not the masseter muscle. Now, this is a match the following kind of question, which you have to mark it right. In the column 1, we have got the function, that is taste sensation from anterior two-third, the taste sensation from different area, and the column B is the nerve. So you have to match the following it correctly. So taste sensation from anterior two-third of the tongue is carried by which nerve? Taste. So it is talking about the taste. So basically you have to come to the right answer. So if I talk about taste sensation, it is basically carried by the coda tympanic nerve. So that is coda tympanic nerve. And coda tympanic nerve is a branch of facial nerve. Taste sensation for posterior one-third of the tongue is carried by glossopharyngeal nerve. So it means A second, B is first, and C is sensation of epiglottis will be from the vagus, that is posterior most part of the tongue, and D is muscles of chewing by mandibular nerve, that is trigeminal nerve. That means A second, B 1, C 3. So that means A is the correct answer. Coda tympanic nerve is a branch of facial nerve. Absolutely correct, Sada. So we have got the right answer, and the match the following is the answer A. So the answer A is the correct answer. Okay, let's move on to the next. So obviously we have got, I have already told you the correct correlation. Let's move on to the next MCQ. So before moving to the next MCQ, tongue is again another important topic, motor supply. If I talk about all the muscles of the tongue, they are supplied by hypoglossal nerve except the odd man out, that is the platoglossus muscle. Platoglossus muscle is supplied by vagus nerve. If I talk about the sensation, the anterior two-third part of the tongue, that means this is, so I'm highlighting this. So what is this? If I talk about this structure, this is exactly, if I talk about this is exactly sulcus terminalis, and the part of the tongue which is lying anterior to sulcus terminalis is anterior two-third part of the tongue, which is getting its general sensation from lingual nerve, and that of the special taste sensation from the coda tympanic nerve. If I talk about the posterior part of the tongue along with this circumvallate papilla. So this is getting innervation from glossopharyngeal nerve, both taste fibers and that of general sensation. And the most posterior most part of the tongue, along with this E for the epiglottis, which is attached to the posterior part of the tongue, it is getting innervation from vagus nerve, which branch? Internal laryngeal nerve. Let's move on to the next, that is question number 6. A child was asked by the dentist to show his tongue. Which of the muscle is responsible for protrusion of the tongue? So here A, B, C, D is marked, and I'm just enlarging this image so that you can have an idea of which is A muscle, which is the B, C, and D muscle. So exactly if I talk about protrusion of the tongue. Okay, this action is mainly done by genioglossus muscle, which is considered to be the safety muscle of the tongue because it is the muscle which is preventing the tongue from falling backwards. So this is the action of genioglossus muscle. So basically, here A will be the right answer as it is the safety muscle and it is the one muscle which is causing protrusion of the tongue. So I would like to just revise the action of tongue muscle. Protrusion of the tongue, most prominent and most important action is done by genioglossus muscle, a fan-shaped muscle. Retraction is done by styloglossus muscle. Depression is done by hyoglossus muscles. Elevation is done by platoglossus muscle. And if I talk about changing of the shape of the tongue, that is done by intrinsic muscles of the tongue. And the important intrinsic muscles of the tongue are superior longitudinal, inferior longitudinal, and we have got also the transverse and verticalis muscle. Okay, now we will see this. So here in this diagram we can see this is B is genioglossus muscle, and if I talk about C, this is hyoglossus muscle, and D is the platoglossus muscle. D is the platoglossus muscle. B is genioglossus muscle. Okay. So, okay. B is actually, I have marked B on genioglossus, but it is below this. So, this will be the geniohyoid muscle. And here A will be the genioglossus muscle. A will be the genioglossus muscle, which is already the correct answer. Here, already the correct answer. Okay. Now, coming to the safety muscle of the tongue, we have already talked. It is the genioglossus muscle, the most bulky muscle of the tongue, which on bilateral contraction is protruding the tongue. So it is preventing the tongue from falling backwards. Okay. So it's also important that you should be knowing about the intrinsic and extrinsic muscle and the action of individual muscle. So exactly platoglossus muscle is arising from palatine aponeurosis and it is approximating the platoglossal arch. Styloglossus muscle retraction of tongue, hyoglossus muscle depressing the sides of the tongue and making the tongue dorsum convex. Genioglossus muscle protrusion. Let's move on to the next. Question number 7. Patient presents with meningitis and investigation is done for the lumbar puncture for the CSF evaluation. Write down the sequence of structure being pierced by the lumbar puncture as you move from outside to inside. Okay, so this will be 1, this is 2 option, this is the third option, and this is the fourth option. So we will go like this. Okay, 1, 2, 3, and 4. So you have to just tell me that which is the correct answer. So the most first structure which will be penetrated is by the lumbar needle is A, skin and the subcutaneous tissue. Then comes the supraspinous ligament, which is not provided, so it will be C. Then comes the ligamentum flavum, and lastly is the dura mater. So A, C, B, D. A, C, A, C, B, D. C, dear, interspinous will come before. Interspinous will come before ligamentum flavum. Okay, supraspinous, interspinous, and then ligamentum flavum. A, C, D, A, C, B, and D. A, C, B, and D. So A, C, B, A, C, B, D. Yes, A, C, B, D is right. A, C, B, D is right. Okay. That is skin subcutaneous. So the skin is the first structure, then the subcutaneous tissue, then is the supraspinous, then comes the intraspinous ligament. Okay, then comes the intraspinous ligament. Then we have got the ligamentum flavum, epidural space. Then we have got epidural space is containing internal vertebral venous plexus. And then we will have the dura mater, then the arachnoid mater, and lastly we will reach the subarachnoid space. Lastly, we will reach the subarachnoid space. Got it? So this is the right sequence of the structure being pierced. This is the right sequence of structure being pierced. I would like to show you this image where you can see the skin is penetrated by lumbar needle. Then comes the supraspinous, interspinous, ligamentum flavum, epidural space, which contains internal vertebral venous plexus. Thereafter dura mater, arachnoid mater, and the subarachnoid space, which contains the CSF. Done with this was exactly the structures being pierced in order, which we have already marked. Now coming to question number 8, and this is a easy one, but branches of arteries are also very favorite question. So you have to tell me that anterior choroidal artery is a branch of which artery? Anterior choroidal artery is a branch of which artery? whether it's a branch of anterior communicating internal carotid external or anterior cerebral artery. So anterior choroidal artery is a branch of internal carotid artery is absolutely correct. Actually, common carotid artery divides into external and internal carotid artery. If I talk about external carotid artery, it is basically giving blood supply to the head neck region, and the important branches of external carotid artery can be memorized by a mnemonic, that is some anatomists like freaking out poor medical students. Okay, so this is the mnemonic by which you can memorize this. Some anatomists like freaking out poor medical students. Here S for, so these are the branches of external carotid artery. We know that there are three anterior branches of external carotid artery: superior thyroid, lingual, and that of facial. We have got one medial ascending pharyngeal artery, we have got two terminal, and we have got two posterior branches. The two posterior branches of ECA is the posterior auricular occipital, and the two terminal branches are maxillary and superficial temporal. Now coming to the internal carotid artery, it is giving branches in the cervical. It is divided into cervical part, the petrous part, the cavernous part, and the brain part, cerebral part. In this cervical region, internal carotid artery is not giving any branch. In the petrous part, it gives two branches, that is artery to pterygoid canal and caroticotympanic arteries. In the cavernous part, it gives three branches: superior hypophyseal, inferior hypophyseal, and that of meningeal branch. And if I talk about the cerebral part, it gives five branches. It gives five branches. So in the cerebral part, it is giving anterior cerebral artery, middle cerebral artery, posterior communicating artery, and we have got ophthalmic artery, and we have got also the anterior choroidal artery. So the question has been asked, the question has been asked about anterior choroidal artery. So the anterior choroidal artery is a branch of internal carotid artery. Yes, Dr. Yoga Bala. Yes, I can once again tell you the mnemonic of the branches of external carotid artery. Yes, why not? So let me just tell you. Write on the heading branches of external carotid artery. So we have got 8 branches, and the mnemonic are: some anatomist like freaking out poor medical students. Some anatomists like freaking out poor medical students. Okay, so here SALFOPMS. So here S for superior thyroid artery, A for ascending pharyngeal artery, L for lingual artery, F for facial artery, O for occipital artery, P for posterior auricular artery, and another M for maxillary artery, and that of superficial temporal artery. Superficial temporal artery. Is it okay? So we have done with the branches of ECA, and we are already knowing the branches of ICA, 5 branches in the brain, which I have already told you. Done. Now moving to the next MCQ, that is MCQ number 9. A full-term child is born. Actually, I would like to discuss two images. Actually, this two questions which is related to the same topic. Either the question can be asked as a clinical question like this: a full-term child is born with a unilateral cleft palate. The parents are very anxious and want to know the reason of the deformity. The embryonic basis of this defect is the failure of fusion between which two process, that is failure of fusion of lateral nasal process or maxillary process, failure of fusion of frontonasal process and maxillary process, failure of fusion of medial nasal process and maxillary process, or failure of fusion of lateral nasal process and maxillary process. So coming to the right answer, it is between the failure of fusion of medial nasal process and that of maxillary process. Got it, everyone? So this is the C is absolutely right answer. Failure of fusion of medial nasal process and maxillary process. Okay, dear. So basically, actually, this is a case of cleft lip, and we know the cleft lip has got four common varieties. Cleft lip is more common in males, and it is present as 1 in 1,000 birth, and it is more common in the males as compared to females. And actually, they have got four types in which unilateral cleft lip is more common, and this is due to the non-fusion of maxillary process with medial nasal process. If I talk about bilateral cleft lip, it is due to the non-fusion of frontonasal process with the maxillary process. Central hair lip and the hair cleft of lower lip are very uncommon. It is due, if the cleft of lower lip is due to non-fusion of mandibular process, and cleft of upper lip is the cleft central lip. And exactly, if I talk about the hair lip, it is due to the non-formation of philtrum from the frontonasal process. So these are the common varieties which you have to know. And exactly, the other options are not correct. Like for example, if there is non-fusion of lateral nasal and maxillary process, it will lead to a condition which is called as oblique facial cleft. Okay, we have already discussed it too many times in the classes. Failure of frontal and nasal process doesn't happen. It is a case of bilateral cleft lip, and failure of fusion of maxillary lateral nasal process is definitely the oblique facial cleft. So this same type of question has been repeated number of times in the INI-CET exam, in which they will give you an image and then tell you for the correct answer. So in this image, you can see this is a case of unilateral cleft lip. It's a full-term child in the image shown. The parents are very anxious and want to know the reason of deformity. The abnormal reason, the embryological basis of the defect is the non-fusion of failure of fusion of medial nasal process and maxillary process. So we have got C as the correct answer. Okay, done. So I'm not going into details of each variety because we have already done this, and you can see this is a case of unilateral cleft lip, bilateral cleft lip, hair lip, and cleft lower lip. Okay, so we have done with this. Absolutely correct. 10 का answer भी C है. Absolutely correct, dear. Absolutely correct, students. Now let's move on to the next MCQ, that is question number 11. Now, which of these muscles are the muscle of soft palate? The option given is tensor villi. The option given is tensor villi palatini, levator villi palatini, platopharyngeus muscle, stylohyoid muscle. So according to you, which combination of muscle is considered as the muscle of soft palate? So we have discussed in class soft palate number of times. We have discussed the muscles name, and we have also discussed the action and the nerve supply of these muscles. So let me get a right answer then. So yes, and my dear students are absolutely giving the right answer. The correct answer is 1 to 3. That is the tensor villi palatini, levator villi palatini, and platopharyngeus. Can anybody give me the name of other muscles? So other than this, these are the three muscles. Other than this, we have got two more muscle which is considered the muscle of soft palate. Can anybody give me the name? So we have got two more muscles. We have got a total of 5 muscles as the muscle of soft palate. Tensor villi palatini, levator villi palatini, platopharyngeus, and that of musculus uvulae. Yeah, we have got musculus uvulae, plateau. We have also got the platoglossus muscle. So basically, platopharyngeus, platoglossus arising from palatine aponeurosis, tensor villi palatini, musculus uvulae, and levator villi palatini. So we can see here, this is the tensor villi palatini related to pterygoid hamulus, levator villi palatini, musculus uvulae, and this is the palatine aponeurosis, which will give rise to platoglossus and that of platopharyngeus muscle. Musculus uvulae is absolutely right. So actually, it's very important, and so many times in the examination, it has been asked about the nerve supply of these muscles. So all the muscle of soft palate, if I just want you to tell about all the muscles of soft palate, they are getting innervation from the vagus nerve. Okay, vagus nerve, pharyngeal plexus, and only the odd man out is that of tensor villi palatini muscle. Tensor villi palatini muscle, which tenses the soft palate, has got a nerve supply from mandibular nerve. Which nerve? Mandibular nerve branch is nerve to medial pterygoid. Levator villi palatini is getting has got the function of raising the soft palate, Platoglossus muscles pulls the root of the tongue upwards and backward. Platopharyngeus muscle elevates the wall of pharynx, and musculus uvulae elevates the uvula. Done. Now moving on to the next question, that is question number 12. Identify the muscle that is causing depression of mandible. So basically this is an image in which four muscles has been marked. So first thing is the identity. Again, this is an image based question. So first thing is identification of what is A, what is B, what is C, and what is D. Then we come to the right answer, that which of the following muscle is causing the action of depression of mandible. Okay. So yes, we have got A, B, C, D. So first thing is that what is A, what is B, what is C, and D. Okay, so if I talk about A muscle, it is the temporalis muscle. It is temporalis muscle. B is lateral pterygoid muscle. What about C? The C is the cut part of masseter muscle on the outer aspect of the ramus of mandible. What about D? If I'm talking about the D, it is in the inner aspect of the ramus of mandible. So this is medial pterygoid muscle. This muscle is medial pterygoid muscle. So we have got four muscle A, B, C. It's derived from the first pharyngeal arch. There it is derived from the first pharyngeal arch. Tensor villi platini is getting innervation is the embryological was because it is derived from the first pharyngeal arch. Okay. Yeah. So we know only lateral pterygoid is a muscle which has got the action of opening the mouth. That is depression of mandible. So that is the correct one. So we will go with B as the right answer. That is lateral pterygoid muscle. Other than that, exactly, we have already marked the correct answer, that is B, lateral pterygoid, causing the action of depression of mandible. Actually, among the primary muscle of mastication, we have got lateral pterygoid as the one muscle which is opening the mouth and depressing the mandible. So we have got lateral pterygoid. Correct. So it is a short conical muscle with the apex pointing backward. And if I talk about the origin, the lateral pterygoid muscle is having a small upper head and a lower larger head. So upper smaller head is arising from infratemporal surface and crest of greater wing of sphenoid. Okay. And if I talk about the lower head, it arises from the lateral aspect of lateral pterygoid plate of sphenoid bone and inserting as forming a thick tendon, and it inserts into pterygoid fovea in front of the neck of mandible. And also not only a pterygoid fovea it is inserting in the neck of mandible, but it also inserts in the articular disc and the capsule of TM joint. Okay, got it everyone? So it also inserts in the capsule of the TM joint and articular disc of TM joint. Now, here we have got an image where we can see both the heads. So this is the upper head of lateral pterygoid which arises from infratemporal crust. This is the lower head arising from the lateral pterygoid plate and inserting in the fibrous capsule, articular disc and pterygoid fovea of TM joint. Now, among this, all other options which were provided actually is causing the action of elevation of mandible. That is temporalis, masseter and medial pterygoid. All these muscles are elevating the mandible. Now coming to image-based question from the previous year question of INI-CET exam. Can you identify the structure marked with a yellow arrow? So for that, I would like to enlarge this image so you can have a look on this yellow arrow which is on one of the structure. Identify its relation and tell me the correct answer. So option is glossopharyngeal nerve, lingual nerve, hypoglossal nerve and superior laryngeal nerve. Identify the nerve marked in the given image. So actually, if I go with the identification, so I will give you a hint for this. So basically, these are the arteries. Okay, these are arteries. So this nerve is lying superficial. So if I go with this nerve, so this is the nerve. So this nerve is running superficial to carotid arteries. This nerve is running superficial to carotid artery. So the correct answer here will be, definitely the hypoglossal nerve. Definitely the hypoglossal nerve. Okay, the correct answer is hypoglossal nerve. The marked nerve in the specimen is the carotid triangle region, and the marked nerve is passing forward superficial to carotid vessel and deep to posterior belly of digastric. So absolutely the correct answer will be. So the marked structure is hypoglossal nerve. So we have marked it right. So basically we have got the right answer, hypoglossal nerve. If anybody has given the right answer, yes, one of the student has given the right answer, a few students, very good. Yeah. Okay, so actually hypoglossal nerve, 10th nerve, 11th and 12th nerve is related in the posterior part of digastric, and it is basically related in the carotid triangle. These nerves, last three nerves are related in carotid triangle. And if I talk about hypoglossal nerve, its location is superficial to the carotid arteries. Now, coming to the question number 40. Identify vagus nerve in the transverse section of the neck. So, the image which you are seeing is the transverse section of the neck showing the layers of deep cervical fascia. So, it is showing the layers of deep cervical fascia. So, I just want to enlarge this. So, by enlarging this, you can get A, B, C, D. Now, you identify what is A, what is B, what is C, and D. Okay. So vagus nerve, a hint given to you will be the vagus nerve. No, coming to the right, vagus nerve is actually lying inside the carotid sheath. Inside the carotid sheath. If I talk about carotid sheath, it contains internal jugular vein, the carotid artery, and vagus nerve. So here should be A, the right answer. A. A is the right answer. So let me just highlight about the. So I would like to talk about this carotid sheath. This is the carotid sheath, one on either side. And in the carotid sheath, we will talk about the carotid arteries. We will talk about the internal jugular vein, and we have got a nerve. What is this nerve? A marked nerve. So if I'm talking about A marked nerve, this A marked nerve will be that of vagus nerve. So the right answer is definitely vagus nerve. A is the right answer. Okay. Now here you can see the same image. Here we can have a look. So basically, if I talk about the important structures, so here what happens, we can see here. So we are now knowing what is A. So what is A is the vagus nerve. What is it? It is the vagus nerve. Why? Because it is lying inside the carotid sheath. If I talk about D, D is the nerve which is lying in between. So you can see here, this is the T for trachea, this is trachea, and this is the esophagus. So basically this nerve is located related to the tracheoesophageal groove. So what is D? D is recurrent laryngeal nerve. Okay, D is the recurrent laryngeal nerve. And if I talk about B, which is lying posteriorly, is the sympathetic chain posterior to the carotid sheath. So it is lying posterior to carotid sheath. So this will be the sympathetic chain. And D is the spinal nerve. And sorry, C is the spinal nerve. I just want everybody to correlate this image with the image given here. So we have got recurrent laryngeal nerve in relation to tracheoesophageal group, vagus nerve, the 10th cranial nerve inside the carotid sheath, as you can see. Also, if we talk about sympathetic chain, this is related posteriorly to carotid sheath and the spinal nerve in between the posterior muscles. So it is very, very important that you should be aware not only of the transverse section of deep cervical fascia, but you should also be aware of the um, sagittal section of deep cervical fascia. So in the sagittal section and in the transverse section, you can appreciate the most outermost layer of the deep cervical fascia is investing layer of deep cervical fascia, which is enclosing the two muscles, the sternocleidomastoid muscle anteriorly, posteriorly, the trapezius muscle forming the roof of anterior posterior triangle. The pretracheal layer is covering the thyroid gland. Prevertebral layer is continuing in the axilla as the axillary fascia. Okay. Now we will talk about the next MCQ. Okay. So let's move on this clinical MCQ. A 32-year-old woman is admitted to the emergency department with a complaint of pain in the interlateral aspect of thigh. Physical examination revealed a swollen, tender right thigh anteriorly. Extension of the knee was limited due to the pain. Ultrasonography of this area revealed a defect in the fibers of quadriceps muscles confirmed by CT scan of the limb. Which of the following is the embryological origin of the structures? Whether it is lateral plate mesoderm, whether it is dorsolateral migration of neural crest cells, the intermediate mesoderm, and the migration of cells from the paraaxial mesoderm. The key word which you have to know is the patient is having defect in the fibers. A patient is having defect in the fibers of quadriceps muscle, and we have to know the embryological origin for the quadriceps muscle, and that is important. So basically, if I talk about the muscles, so they are actually we will have the muscles develop from the part of somite. Somite is actually formed from paraaxial mesoderm, which is, so migration of cells from paraaxial mesoderm is right. So question number 15, anybody has given the right answer or not? So basically, paraaxial mesoderm is lying very close to that of neural tube and notochord. It will form segment and wedge-shaped structure, which called as the somites, which somites will further form differentiate into three parts: myotome, dermatome, and sclerotome. So from the myotome part, the muscles are formed. So migration of cells from paraaxial mesoderm is right. Now, not lateral plate, because they are forming the linings of the structures. So basically, they are not involved in forming muscles and all, and also not neural crest cells, because they form many of the ganglias and the other structures like conotruncal septums, the ganglias and all. Intermediate mesoderm, urogenital structures it forms. So the right answer is migration of cells from paraaxial mesoderm. Lateral plate mesoderm is forming the lining of the structures. Muscles of the limb develop from the myotome component of somite. So that is, and we know that somite is one of the part which condense from the part of the paraaxial mesoderm. So that is the paraaxial mesoderm. Which component will form? Paraaxial mesoderm will form somite, and somite का कौन सा component बनाएगा आपको muscles? The muscles will be myotome component. So the cells undergo epithelialization process to form somites, that is consist of a ventral portion, the sclerotome, the dorsal portion, and also having the myotome portion. So you can see this is the neural crest cell, this is the notochord neural tube, this is the paraaxial mesoderm forming somite, this is intermediate mesoderm, and this one is the intermediate, and this is the lateral plate mesoderm. Okay, so if I talk about somite differentiation, which is in the form of sclerotome, myotome, and dermatome, the sclerotome will form the vertebrae and the ribs. Sclerotome will form the vertebrae and the rib. Myotome will form the skeleton muscles. The dermatome will form the dermis of the back. Lateral plate mesoderm give rise to the serous membranes and coverings of the structures, organs, heart and organs. Migration of neural crest cells, as I told you, it will form ganglia, squam cells, chromaffin cells of adrenal medulla leptomeningeus. Intermediate mesoderm will give rise to urogenital structures. Now coming to again a image based question, identify the clinical disorder in the given image. So which clinical disorder is this? So you can see actually four options are there, and to identify the correct answer, what you can see here, the image which has been shared, you can see there is deformity for the mandible. So very small mandible is there, deformed mandible. Underdeveloped zygomatic bone is also the cheekbones are underdeveloped, zygomatic bone is not formed properly. Then we have got downward slanting palpable fissure, and external ears are deformed. External ears are deformed. And we have got downward slanting palpebrae fissure. Fine. So basically, this is a case of Treacher's Collins syndrome. What is this condition? This condition is a case of Treacher's Collins syndrome. Okay. So that is absolutely right answer A. So we can see this, and we have already talked in the previous classes that this is a condition of Treacher's Collins syndrome. Image-based question is again a very important point. Clinical and image-based questions are favorite questions to be asked for the INI-CET exam. Okay. Now coming to question number 17. So a neonate is presenting with a marked cyanosis in the lower extremities. So marked cyanosis in the lower extremities, cardiomegaly and dyspnea is diagnosed in the case with patent ductus arteriosus. The condition is due to faulty migration of neural crest cells that is leading to the partial development of which of the following embryological structures. So the option given is right subclavian artery, pulmonary septum, tricuspid valve, and inferior vena cava. So actually question number 70. So this, if we go through this MCQ again, this is a clinical question, but ultimately what they are asking is the migration of neural crest cells is defective migration of neural crest cells is giving rise to which of the following condition. So we have to go with the right answer here, and we know that neural crest cells are giving rise to many structures. So in that case, if I talk about neural crest cells, this is giving rise to many structures, and one of the structure is called pulmonary septum, conotruncal septum, and it gives rise to many ganglia, meninges, leptomeninges, and the adrenal medulla, chromaffin cells. So basically you have to know this list of structures which is always asked in examination. So you have to go through this neural crest cells derivative. So it forms connective tissue, bones of the face and skull, cranial nerve ganglia, C cells of thyroid gland, odontoblast, sympathetic ganglia, preaortic ganglia, adrenal medulla, squamous cells, glial cells, leptomeninges, and smooth muscle blood vessels related to the face. So I want you, this is the list which I have taken from the Langman. So you have to go through this list and you have to by heart this list, because this has been asked several times in the examination. Then you have to know about all the derivatives of NCC, that is neural crest cells. So there is mnemonic for it, CA motal, like this. Mnemonics are also there. Please go through the derivatives. Now coming to the next, obviously right subclavian it is not derived. It's in relation to the right from the fourth pharyngeal arch, tricuspid valve from proliferation of tissues of articoventricular canal, inferior vena cava is not the origin. It arises from Whiteley veins. Question number 18. A 42-year-old woman is undergoing thyroidectomy. Postoperatively, the patient suffers from the loss of sensation within the larynx from the vocal cord upward to the entrance of the larynx, allowing for aspiration of liquid into the airways, which is the nerve which is injured in this case. The most important point which has to be given importance here or highlighted is that the loss of sensation is within the pharynx from the vocal fold upward to the entrance of the larynx. So exactly upper part of laryngeal cavity is involved. Okay, so sensation with the larynx from upward to that of larynx. So basically if we talk about laryngeal cavity, the upper part of the larynx has been involved. So upper part of larynx or laryngeal cavity, or so that is basically sensation of the larynx from the vocal cord upward to that of the entrance of larynx. So if I talk about the sensation of the upper part, it is from internal laryngeal nerve, and the part below this lower part of the laryngeal cavity is definitely getting innervation from recurrent laryngeal nerve. This is about the sensory innervation. So if I have to mark the right answer is internal laryngeal nerve. Okay. So if there is an injury in the internal laryngeal nerve, the protective cuff reflex or the loss of sensation above the vocal cord is gone. And in case if the internal laryngeal nerve is injured, then it can be actually very important for you to understand that it is also related with the thyroid membrane, and it is also involved in protective cuff reflex. And if it is injured, that is also lost. Okay, so in this diagram, I just want everybody to understand if I'm talking about internal laryngeal nerve, actually internal superior laryngeal nerve, both are the branch of vagus nerve as shown in this diagram. So basically internal laryngeal nerve is sensory. So basically internal laryngeal nerve is a branch of superior laryngeal nerve, and superior laryngeal nerve is giving one as the internal and the other one as the external laryngeal nerve. External laryngeal nerve gives innervation to cricothyroid muscle, only one muscle, that is the tensor of the vocal cord. Internal laryngeal nerve is sensory and gives innervation to the upper part of laryngeal cavity above the vocal cords. And lower part of the laryngeal cavity gets sensory innervation from recurrent laryngeal nerve. And all the intrinsic muscles of larynx is also supplied from the recurrent laryngeal nerve. Coming to question number 19. A 45-year-old man is admitted to the hospital with difficulty in swallowing. Physical examination reveals that the patient has got a episode of severe headaches and frequently aspirates the fluid while drinking them. A radiographic examination reveals skull base tumor occupying the space behind the jugular foramen. Involvement of which of the following structure most likely is responsible for the patient condition? Option A, ansa cervicalis, external laryngeal nerve, hypoglossal nerve, or vagus nerve. So basically, in this case, what we can see, the patient has got severe headaches, okay, and aspirates the fluids when drinking the severe headache. Aspiration is there, and a base skull is occupying jugular foramen. So involvement of jugular foramen is related with the 9th, 10th, 11th nerve. So definitely vagus nerve, and D is the right answer. So if I talk about jugular foramen, 9th, 10th, and 11th cranial nerve is passing through it. Other than that, inferior petrosal sinus and sigmoid sinus and internal jugular vein, along with the meningeal branches of occipital and ascending pharyngeal arteries passing. So definitely, we will have 10th cranial nerve as the right answer. Question number 20. A 46-year-old woman is diagnosed with a tumor at the base of the skull, resulting in decrease of tear production. So, tear production reduced hai. Which of the following nerve is most likely injured in this case? Okay, the option given is coda tympanic nerve, deep petrosal nerve, nasociliary, and greater petrosal nerve. So actually, if we talk about this MCQ, then decrease in tear production, actually one of the branch of facial nerve, the first branch from the facial nerve, that is greater petrosal nerve. Greater petrosal nerve is involved in giving innervation to lacrimal gland. So we will have C as the right answer. Everybody, what is the right answer? C. So I just want you to show the flow chart of innervation of lacrimal gland. So lacrimal gland innervation and its secretion of tear is via parasympathetic innervation. So parasympathetic innervation is there. Greater petrosal nerve, which is a branch of facial nerve, will join with the deep petrosal nerve and will lead to the formation of nerve of pterygoid canal, which is also called as Viardin nerve. After that, these fibers will relay. Okay, this will relay in pterygopalatine ganglion. Postganglionic fibers will join the lacrimal zygomatic nerve through the communicating branch, and through lacrimal nerve will give innervation to which structures? Lacrimal gland. So this is a simple flow chart which is showing you how the secretion from lacrimal gland takes place. Okay. तो यहाँ पे हमें पता चला greater petrosal nerve is mainly involved. And if we talk about the right answer, we will definitely go with the C as the right answer. What is it? Greater petrosal nerve, which is giving secretion, which is important for the tear production from the lacrimal gland. So we will have C as the right answer. Okay, coming to the next question number 21. Which of the following is true statement about cavernous sinus? So in this question, this is a question about the relation of the cavernous sinus. So whether oculomotor nerve is related in medial wall, trochlear nerve in the medial wall. Hypophysis cerebri, what does that mean? That is pituitary gland and sphenoidal ear sinus related laterally. Temporal bone with the uncus is related laterally. So you have to again come up with the right answer. The option are here, and let me tell you about the correct answer. The correct answer is temporal lobe and uncus related laterally. Now, why not A is the right answer, my dear students? Oculomotor nerve in the medial wall is wrong. It is related to the lateral wall. I will show you the image also. Trochlear nerve is also related to lateral wall, not with the medial wall. And pituitary gland and sphenoidal ear sinus are related in the medial aspect, in the medially to the cavernous sinus. So basically in this image you can see oculomotor, trochlear and ophthalmic in the lateral wall. According to the new books, maxillary nerve is not related in the lateral wall. And also if I talk about pituitary gland, hypophysis cerebri and sphenoidal ear sinus, they are related medial aspect to that of the cavernous sinus. And the nerve, internal and abducens nerve, these are the two structures, internal carotid artery and abducens nerve, these are the two structure which is passing through the cavernous sinus. Okay, now coming to the next, this is also an image based question for the why I'm showing you so many images questions related to the same topic, because cavernous sinus is a very important topic for your INI-CET exam. So firstly, I would like to enlarge this image. This is again showing you cavernous sinus. Okay, so blue color structure is a cavernous sinus. Now a black color arrow is marked on one of the structure. Can you tell me which nerve is this? So identify the nerve and give me the clinical scenario. What will be the clinical scenario? So identify, tell me the name of the nerve. Just now I have shown you a schematic diagram and help you to understand the nerves in relation to cavernous sinus. So कौन सा nerve है ये बच्चे बताएं, which nerve is this and what will be the right answer? So basically the nerve is the sixth cranial nerve and it gives innervation to one muscle, lateral rectus. So when lateral rectus muscle is paralyzed, what will happen? Lateral movement of the eye is not possible. Lateral movement of the eye is not possible. So the eye is not able to move laterally, so we will have the medial squint. So B is the right answer. Absolutely correct. So lateral rectus is supplied by LR6, SO4. Superior oblique is supplied by trochlear. Here lateral rectus is supplied by sixth cranial nerve passing inside the cavernous sinus, which will give innervation to lateral rectus, which is abducting, which is moving the eyeball laterally. So basically, if it is paralyzed, if it is not working, the patient will have medial squint of the affected eye. Yeah, so it is not working, no, disorder. Yes, dear, you are right, disorder. Okay, so same thing has been shown you, the correlation of the image. Okay, now coming to the image-based question of histology. So image of hematoxylin and eosin stained section of tissue has been shown. The tissue is shown in the lower two-thirds of the picture. Can you see here? And you have to tell me that which is the tissue, whether it is a hyaline cartilage, whether it is fibrocartilage, whether it is elastic cartilage. Identify it and then tell me the example of that cartilage. So basically, if you are not able to solve, I will tell you the answers. Also, I will help you. This is actually pericornum. So this is the outer part of pericornum. So this is the fibrous and this is the chondrogenic layer of perichondrium. So perichondrium is the outer covering of the cartilage. This is an example of hyaline cartilage. Hyaline cartilage. Which variety of hyaline cartilage? It is an example of costal variety of hyaline cartilage. So this outer is P. What does P stands for? Perichondrium. And this is the two layers of perichondrium and these are cell nest. What are these? So actually this is the cell nest. That means isogenic layer of the cell nest and chondrocytes which is residing in the group, as you can see here. And actually what happens? The bluish color which you are seeing is homogeneous appearance of the hyaline cartilage costal variety, and we know that epiphyseal plate is an example of hyaline cartilage. So definitely the right answer is C and the images of hyaline cartilage. So definitely the right answer is epiphyseal cartilage. So basically this is again an image based question. You can see here a 71-year-old person, woman is having diplopia. Examination is showing paralysis of muscle marked with the arrow. So diagnosis and involvement and contralateral nerve in MRIs in the midbrain. So yes, the nerve is at the level of midbrain. Okay, so can you tell me the nerve, which of the following nerve is involved? So firstly, identify this muscle. This is one of the extraocular muscles. So which muscle is this? This is lying superiorly. So this is superior rectus muscle. Which muscle is this? This is superior rectus muscle. Okay, this is annulus of Jin. So this is superior rectus muscle. This is medial rectus muscle. This is inferior rectus muscle. And this is the lateral rectus, LR for lateral rectus muscle. So which muscle is this? Superior rectus. And we know that all the extraocular muscle is supplied by oculomotor nerve except LR6 and SO4. Superior oblique by trochlear and lateral rectus by the abducer nerve. So the right answer is oculomotor nerve. So what is the right answer for question number 24? B, oculomotor nerve. Oculomotor nerve. Now, the another question, glossopharyngeal nerve passes through which of the following marked gaps? So this is an image which is showing you the image of the constrictor muscles of the pharynx. So this is again has been asked in INI-CET exam in the previous year of examination. So you have to know what is A gap, what is B gap, what is C and what is D. Okay, so basically A gap is the space which is lying between the between the skull and the superior constrictor muscle. So this is SC, superior constrictor muscle. This is the middle constrictor muscle and this is the inferior constrictor muscle. So B is the gap between superior and middle constrictor muscle. So can you tell me the structures passing? Also, glossopharyngeal nerve is passing in which gap? So obviously B is the right answer. Definitely, glossopharyngeal nerve passes with the gap B. If I talk about A gap, it is the sinus morgagini, and through sinus morgagini, this is the upper space. Four structures passes. What is it? Levator palatini muscle, levator palatini muscle, ascending pharyngeal artery, Ascending palatine artery, ascending pharyngeal artery, palatine branch. We have also got the eustachian tube passing through it. Through B gap, we have got ninth cranial nerve and stylopharyngeus muscle supplied by it. Through the C gap, we have got internal laryngeal nerve and that of superior laryngeal vessels, arteries, vessels. And through the deep, which is lying lower to inferior constrictor muscle, we have got recurrent laryngeal nerve and that of inferior laryngeal vessels. Okay, dear. So we have got definitely the right answer. So with this, I'm coming to the end of this session. All the best for your INI-CET exam. And actually, I have tried to cover the most important MCQs and most important topic MCQs for your upcoming INI-CET examination. All the best and do be the part of DBMCI MDS group on Facebook and Telegram. Your goal is our mission. So do be the part of all the GTs and INI-CET tests. This will be highly beneficial for you. All the best and keep studying. Any doubt, you can connect to us in the Telegram group and get your doubts cleared by the respective faculty teachers. All the best. Keep studying. Thank you so much. Okay, dear. Thanks.